Welcome to Speaking of Higher Ed, Conversations on Teaching and Learning. This podcast is produced by the Center for Instructional Innovation at Augusta University. I'm your host, Andrew Everett. This is episode 11. We release new episodes the third Wednesday of each month in spring and fall semesters. Please take a moment to rate, review, and subscribe to the podcast. Our guest today is
Dan Kaminstein.
Well, thank you for being here, Dr. Kaminstein. You are the Assistant Dean for Ultrasound Education and Professor of Emergency Medicine in the Medical College of Georgia here at Augusta University. So that our listeners can get to know a little about you, will you share briefly the professional path that brought you here?
Sure. I was a resident here, so I trained in emergency medicine here. I actually grew up and did a lot of my schooling in the Northeast, initially in Philadelphia, and then I came down here for residency. My wife and I actually couples matched, so it's a pretty complicated process when you end medical school. You actually apply to a bunch of different residencies, but the way it's decided is essentially a matching process. And so the residencies rank you, and then you rank the residencies, and then essentially where those two meet up is where you end up. And so you don't really get a choice. You kind of end up in one place. So my wife and I came together here to Augusta back in 2007 to do residency. So I did emergency medicine. She did family medicine. I stayed on actually to do some additional training, both in ultrasound and in global health. And I finished up those fellowships. That took me another year and a half additional to my normal emergency medicine training. I actually left for about 4 years back in Pennsylvania practicing clinically emergency medicine. And then my current boss, a good friend of mine, Matt Lyon, who now heads up our experiential learning department at MCG, called me and said, hey, we want you to come back and do teaching in the medical school. We'd like to use some of your skills in ultrasound and global health and come back and do some teaching. And so I've been back here since about 2016, helping with the medical school, doing a lot of teaching, primarily in ultrasound and running the global health program for our medical students, and then working clinically in the emergency department as well.
Well, we're glad you came back.
Yeah, it's good to be back. Yeah.
And we're glad to talk to you today about this topic, which is active learning curriculum. And I know you use active learning curriculum as your approach to your courses, but let's start by discussing your early educational experiences. You grew up in a Montessori school. So Will you talk about that?
Yeah, I think that's, I think when you think about active learning or experiential learning, and they are defined in slightly different ways. And so I think you can use them interchangeably. I'll probably try to be explicit about when I say active learning or experiential learning, kind of how I'm envisioning it. So for those who know more strict definitions or thinking about it in a specific way, we can kind of speak the same language. But Montessori, for those who don't know, is a type of education that really focuses on following children in their path and kind of their interest and guiding them in that process. So Maria Montessori, who came up with the idea of Montessori, really created materials, very specific concrete materials that kids could use to visualize things. So that might be letters. Rather than just writing letters, she actually had them trace them out in sandpaper, or giving them specific mathematical tools so they could visualize how a cube or a square or all of those things work. And so in a Montessori classroom, you have mixed ages. So usually it's 3 different years. You might have first, second, and third grade all learning together. It allows students to progress at their own rate. You have a teacher who's very focused on the development of each child, but allowing them to kind of guide that development and allowing the children to develop independently. So you might have one child who's a first grader by age, but they may be doing third grade math. You may have a third grader who's doing second grade math. And the classroom allows all those kids to kind of work together and without feeling like they're behind or ahead. And the teacher's job really is to then to kind of guide that learning. A lot of it is active learning in the sense that the kids are doing hands-on things. So they're using hands-on materials to learn the concepts that we would traditionally think about as geography, math, language arts, all of those types of things. So I grew up in that process. My mom was a Montessori teacher. So from pre-kindergarten through about 6th grade, I was in a Montessori classroom. I transitioned from that. And Montessori really mostly goes up through middle school. There are very few Montessori high schools. And so I transitioned in 6th grade to a public middle school and then finished out my high school in a public high school as well.
So you got to see both sides of the educational approaches. So what is your assessment of the two, and how did you make that transition? What was tough for you and what worked better?
I went from, a classroom of 6 of us, who are in my grade to a class of probably 200 students in my 7th grade middle school, changing classrooms with classrooms that are focused on, okay, we're doing math now, or we're doing science now. And I think the interesting thing is thinking back on it now and talking to my parents even, the transition was not very difficult in terms of moving from having a lot of independence to having a lot of structure. I felt that, okay, it was pretty easy for me to get directions. I kind of knew what I was supposed to do because each classroom was pretty explicit. And it wasn't actually that hard to move from kind of more independence to a little bit more of explicit. Okay, now we're going to do these pages. And so I didn't find that kind of the process very difficult. I think the thing as I think through it and looking back on it is I got into a pretty fixed approach to, okay, this is what I have to do to get the grades that I need to get or to do the things I need to do. And some of my own kind of self-driven curiosity and exploring topics went away. So there's a lot of that in Montessori because I had a lot more freedom of, I'm interested in this. I'm just going to spend 2 days doing something, researching something or learning this math concept. And it didn't really matter. I could spend 2 days solid on a project. And my teacher realized that that was something I was interested in. It's a lot harder to go deep into topics when you have 3 or 4 different homework assignments. And so I think that's the thing that was lost a little bit is that kind of self-driven curiosity. And in high school, that really manifested as I was able to take my classes, do the work I needed to do. I was always pretty successful in getting the work done, but it didn't ever feel like there was a purpose to it. So, into other than getting grades. And so I think I lost a little bit of that kind of innate curiosity as I transitioned from a more more self-directed learning approach to a little bit more of a lot more didactic kind of teacher-directed learning approach.
So how did these two approaches, now you're on in your higher ed career, you're teaching, how did those two approaches inform how you approach your curriculum?
Well, in my medical school experience, I would say, I hope for most, if there are any undergraduates listening, so what I loved about my college university experience was there was a lot to choose from. I mean, there's a lot of cool things going on. There was a lot of interesting professors. And while I did have a major, I was allowed to try to take photography. I did a poetry class. And it was really fun to be able to sample and pick and choose from those things. When I got to medical school, it was very prescriptive. And so in medical school, you really had to, these were the things you had to do. And it was very clear the path you had to take and how you had to take that path. And it was probably, as much as I enjoy being a physician, I would say my medical school experience was one of the least enjoyable educational experiences because it was so prescriptive and there was very little margin for error and it was very time consuming. And so I think as I approached, okay, what does this mean to be an educator? I had a crisis of faith a little bit as I came back because I had a lot of expertise in ultrasound and global health, but what I didn't have a lot of expertise in was teaching. I think one of the things for a lot of us, and I talk about this when I am working with faculty, whether that be medical school faculty or other AU faculty, I talk a lot about, well, you can be a subject matter expert. That does not necessarily make you an expert in teaching. And that's what I found. I have some subject matter expertise in things like ultrasound in emergency medicine. That doesn't necessarily tell me that I know the best method to communicate that to novice learners. And so that was the thing that I really struggled with as I came back, kind of coming from all of these different educational experiences, Montessori, traditional public school education, having a really good time in university, then going through medical school, going through residency, having a chance to do fellowships or some more specialized training. I kind of was trying to put that all together and say, well, what does a teaching approach look like? And that's really kind of where I started to think about, well, what does the literature say? What are best practices? And so as I kind of got into teaching in the medical school, I really wanted to make my students' experience better than the experience I had when I was in medical school.
So in this time of research, what did you discover?
Well, what I ended up doing, so the other thing I ended up doing is I actually did a master's in education, and I spent a lot of time just looking into what is the literature out there? What do people have to say about educational best practices? What kind of different educational approaches are out there? What theories and learning theories actually inform the decisions we make? And so if you talk to the folks who are in the School of Education here, I mean, a lot of this stuff is just second nature to them, but I think it's not necessarily second nature to the rest of us who are living the teaching day to day. Is we may not have just the background knowledge of what all those different theories are and how they can potentially inform our practice. And so I really found that there's a lot to grasp and a lot to hold on to as I got very interested in teaching approaches is how can I use some of these, so the research, how can I use some of these theories to actually help me make decisions about teaching and then get feedback on that. Okay, did this work? Did this not work? If it didn't work, how can I use the literature that I know about to actually inform me about why it may or may not have worked? Yeah.
So what are some elements from your, I guess when you reflect back on the early years of grade school, are there some elements or principles from that time that you think could be applied to the traditional higher ed environment?
Yeah. And I think that's probably, as I think back and think through my experiences and also kind of the learning theory that I've started to understand more and more, I have to kind of make a disclosure that I have very specific, as I think about this, the way I approach teaching, I have a very specific view of that. And that may not be the view that everyone has. And so I acknowledge that I'm kind of coming at this with my specific lens and my experiences. I'm advocating for specific things based on kind of my, kind of what I think we should be doing in education. But other folks may come from different lenses or have different specialties where they say, well, that approach may not work perfectly for me. And so I have to make that disclosure. And I would say the thing that what I mean by that is I firmly believe in the concept of co-construction of knowledge, which means that anytime you're in an educational experience, it isn't just me giving you facts. So I might teach you something, but actually every educational encounter is us working together and coming to an educational outcome together. So that's student and learner. I may have some specific knowledge in areas, ultrasound, for example. I may have a lot of experience with ultrasound, but teaching you ultrasound, you come with your own background, your own understanding. And for me to connect with you and actually for us to do a learning process, I have to learn from you. I have to know what your background is. I have to understand where you come from. How much ultrasound do you know? And so at the end of that experience, whether that be in the classroom, giving a lecture. So, this will be a side topic, but for example, so people say, well, I don't understand how active learning and co-construction of knowledge works in a lecture hall. Well, anyone who's been in a lecture hall and you lecture out to 200 students, you're getting feedback constantly. Like, are they paying attention? Are they all looking at their laptops? Like, who's actually, if you ask a question, who's responding? Who's sitting in the back? Who's sitting in the front? Those are all back and forth things. And actually, you're learning from your class. So every time I give a lecture, I learn from my class based on their body position, based on again, how much digitally are they paying attention to me versus are they disengaged? And so every time you do that, you're learning. And so I feel that I approach learning as this joint productive activity. And that really goes into specific theories about how we learn and how we guide students through their learning. Rather than being kind of the dispenser of facts and the arbiter of what's right and wrong, we actually are engaged in that process of helping our learner move to more independence.
So we're seeing here in higher ed, experiential learning is a hot topic. Mentorships, we have interdisciplinary research and other activities. So how do these contribute to an active learning environment?
Yeah, that's great. So I think that leads in really well. So if we say, again, if as I advocate that we're in joint productive activities, that we're learning from each other, then one of the great ways to really learn together is actually to create dynamic environments where students and educators are actually working on a project in some way together. And that's creating some type of active learning environment. Okay. And that can be, the simpler things is creating some type of, audience response system. That is a degree of active learning where I'm asking questions, I'm getting responses, and I can react to that and say, wow, everyone seems to know the answer to this. We can skip this part. And so if you go look at some of the suggestions and kind of how to make a lecture more engaging, you can poll the audience, and that can be active learning, I think. And you're learning from the students. The more you move into really creating experiences for students where you're really kind of getting them into a real world experience, the more you're able to learn from your students, help guide them, the less control you have too. And so to me, an active learning environment is something where you can really craft an experience. Again, that can be in any setting. You're crafting that experience. A lot of the time is spent in crafting an experience that the students feel safe in, the students actually can engage in, that there's some learning that you feel is hopefully coming out of that. And so you want to have some idea of what the students are going to learn. But you aren't fully in control in the sense that you can just give, that at the end, they're going to know exactly the things you wanted them to know. And so those active learning environments, I really think, an internship is a great example of. I may send you off to an internship. You have real world experiences. We then debrief those experiences together. We can talk about how you integrate those experiences to the rest of your learning career, the rest of the, whatever subject you're teaching. So I think that's really kind of how I see those two together. So, if the more we empower the students to actually do the things that kind of create, thinking beyond just the knowing the right answer, the more room there is to grow and more ability for kind of co-construction and really kind of understanding where a student is in their learning process.
So you talked earlier about, the feeling of just getting grades.
Yeah.
And that was a different feeling in high school. So in college, how do we go beyond just getting grades? What do we need to do there? Because how do you assess these active learning things and mentorship and other situations?
That's, the biggest challenge right now. So in experiential learning, which is a slightly different topic, or a slightly different concept. And I say specifically experiential learning, and experiential learning theory talks about students having experience, allowing them time to then kind of experiment, reflect on that experience, and then and go back on it and continually revisit this. And so Kolb kind of talks about his experiential learning cycle, where we are constantly in this cycle of experiencing, reflecting, practicing, experiencing, reflecting, practicing. So constantly iterating. And so the question is, well, at what point have you mastered the material? And so my answer to that is, so how do we assess that? Well, the first thing I would say is that you just stop grading people. And I say across the board, no matter what topic, you just stop assigning grades. And that's, I think to me, the reason I say that is because we're not teaching for mastery necessarily of a topic. And that doesn't mean that students can't master a topic. It just means that me teaching for mastery of a single subject actually may not empower the students to grow and actually be able to do experiences, learn from those experiences, reflect on those experiences, and continue to learn in a topic. So if I tell you got an A+ in my class, that may not actually open the students up to continuing to want to master that subject because they think they've mastered it already. So the way that you do this is you actually stop. First of all, you have to stop worrying about grading people.
So if you're not giving them a grade, what feedback are you giving them that helps them continue to grow and be interested in the topic?
So everything you do is feedback for learning. So everything we do as educators is feedback for learning. How do you systematize that? How do you actually create a system where that helps the student and the educator can be on the same page? Is again, an open debate. I would say there's a lot of theory around this in terms of programs of assessment that talk about actually creating multiple ways for students to get feedback. That is oftentimes summative feedback, but a lot of formative feedback as well, where they're getting feedback from the different things they're doing. And you're actually creating more of a dashboard around helping them see all that different feedback and using that feedback to say, hey, this is how far you are in the process of becoming more and more independent and becoming more self-directed in that learning. So that's usually programs of assessment, I'd say, is the thing that I found the most exciting and dynamic about how we actually move from a letter-based system to a system that really is going to support our students to continue to learn throughout that process.
So I have nearly 50 students, mostly freshmen, in an online course.
Yeah.
They're not active until they hear grade.
Right.
If I send them an email, they don't respond until grade is somewhere in the subject line. So is there any research on how going from no grade or from grading to no grades may actually help get students enthused or engaged in the material?
There is a lot of different research on, across the board and, from middle schools, high schools to undergraduate schools to graduate schools going to a kind of a no grading system. So there's a lot of different research on that. I guess I would answer your question with a question, which is kind of what's your goal at the end, when students finish your online class, what's the goal that you hope that they have achieved?
That makes sense. So we're aligning all of that with the module and the course objectives. So basically keep that alignment in mind so that you know where your feedback is going.
I think to some extent, I think if your goal is, I want all the students to know exactly how to do this specific type of calculus, for example, and you say, I don't, there's no other use for this. I just want them to know how to do calculus at the end of this class and know how to solve these specific problems. Then if the goal is endpoint learning, then grades are fine because you're going to tell them along the way, how far did you get to mastering this specific area? I hope as educators, very few of us are in that standpoint where the end of our class is that's all we care about, in terms of our students. So I have the advantage of getting to work with students from the day one of medical school. And I teach students throughout all 4 years of medical school. I teach them in residency. I teach them in fellowship. So I get to see these learners progress through day one of medical school. So they're coming out of undergraduate. So for all those who are teaching undergraduate classes and worry about how obsessed their pre-meds are with grades, and it doesn't get any better. Once they get to medical school, they still become very obsessed with grades and points and scores. And so it's not like they get to medical school and all of a sudden they're growth-minded learners. And I see that process continue throughout to even for us as faculty members, we still get stuck in this step. And so the reason I get so passionate about this is because I think as educators, our goal is to actually help the students continue to progress in their learning experience. So grades don't really tell you much unless you're very intentional. They don't really have growth-minded goals to them, really. They just tell you how much have you mastered my topic. And so if your goal is, I want you to master the material that I think is important, then okay, you can use grades. But if you want to say, I want to help you become a more impassioned student about anything you teach, then grades don't actually really tell the student that much, right? So if you think about dashboard, we talk about student dashboards. I don't know if is that something that comes up in undergraduate?
I would say not necessarily, not that I can think of.
I mean, I would say in medical education, and I think this is a topic in generally adult education, the idea of a dashboard of different feedback, right? So you want to have multiple things feeding back into your educational progression. So the concept would be if all I care about is my speed, right? So I'm driving a car and I pay no attention to my RPMs, my engine temperature, how much gas I have, where I am, then I have a pretty limited amount of information about how well I'm driving my car, right? So the dashboard it gives you a lot of other, how much gas do you have? How fat, how high are your RPMs, all of those things. And I think as we think about students learning, the grades I think of as our speed, right? It's, how fast essentially is a student going towards mastery, or not even, I wouldn't say mastery, but how fast is a student going, or how, but the rest of it, we don't pay as much attention to kind of how does all that fit in. And so if we become very hyper-focused on grades, it only tells you how well the student's doing in your area, or your specific class. It doesn't have anything to do with how they're progressing. They may be failing all the other classes. They look like an A+ student to you. If they're failing all their other classes, I would say as an educator, you probably aren't helping their learning progress, even if they're mastering your material.
That certainly makes sense. So it gives you a more full picture of the student's performance.
Yeah. And I will say, so the real question, hopefully, if everyone's listening to this, they're like, well, great, I agree with you, but how do I do it? And that's, I think that's something that I'm really curious about. I don't think there is one, I can't give you a solution that's like, okay, here's a ready-built solution. I guess my call is, can we become more growth-minded educators? Can we foster more growth-minded students?
So what are some of the student outcomes that we can see from an active learning curriculum and using these principles in our courses?
Yeah, and when I've done a lot with growth mind. So I talk about growth mindset, and certainly that's another kind of course that I started doing with some faculty is talking about growth mindset. And so one of the things I think the big outcome we would see is students who are able to actually fail productively. So I think most of us say I think most of us as educators say, well, failure is an opportunity to learn and grow. Most of us don't, well, I wouldn't say most of us, but a lot of times we don't take our own failure as an opportunity to learn and grow. And I would say a lot of our students don't see productive failure as a productive thing. And so one of the big outcomes is you have students who can actually approach learning in a growth-minded manner. So seeing it as a challenge, looking for opportunities, that everything you do is a learning opportunity, a chance for growth, that trying things out that are hard is a chance to fail and then learn from that and then keep trying harder. If we make grades pass or fail If we say to a student, if you fail this, then you're not good at it, or if you fail this, then you're out of this class, that doesn't foster the growth minded of let's fail, let's talk about why, how you failed. Let's think about effort in terms of ongoing practice to actually learn and improve in that. Most of our students, I think whether it's undergraduate or in the medical school, come with very different levels of experience. And so some students may be very good at things just because they've had a background in that. Other students may be very bad at it, but given a chance to practice and continue to work on things, they may excel. But if we start assigning them grades very early on, we tend to reinforce this mindset of this is where your abilities are.
I see. So before we take a break, is there anything that I didn't ask that you want to talk about active learning?
I think when we come back, we should just talk about, well, how do you fit those two together? So you have a growth mindset. We're trying to help students grow. We said that we're not allowed to use grades. So how do those three things, if we're not grading students, if we're asking them to be more active and engaged, and we're looking for them to fail, and work and kind of build a mindset of, I need to continue to grow and practice and work at things. How do all those kind of fit together? What might that look like? And to foreshadow, I think going back to my previous experiences, I think there's a lot we can learn from Montessori education, kind of helping us at least move in that right direction.
All right, we'll take a quick break and come back, wrap it up, and ask our continuing the conversation question.
Hi, I'm James Garner, Associate Director of the Center for Writing Excellence, and I'm excited to share with you about this great resource. The Center for Writing Excellence, housed within the Pamplin College of Arts, Humanities, and Social Sciences, offers personalized writing and speaking support to the entire Augusta University community, including undergraduate students, graduate students, postdoctoral fellows, residents, and faculty. Faculty are encouraged to use the Center's one-on-one consultations, either online or in person, to improve their writing process and meet writing and research goals. Whether you're working on a funding application, a publication, or a presentation, our team of professional writing consultants can help. Learn more about the Center for Writing Excellence at our website, www.augusta.edu/CWE. Contact us by phone at 706-737-1402 or by email at cwe@augusta.edu. We look forward to working with you.
Welcome back to Speaking of Higher Ed. We're here with Dr. Kaminstein. So you're advocating for no grading. So if
Absolutely,
no grading, then how do we do this? What are we reinventing?
What do we do? Yeah, that's a good question. So, you told me, during the break, you told me that you spend most of your time kind of getting students to turn in assignments. And how much time do you think you spend thinking about and doing the grading part of your teaching?
Several hours. I would say more than several hours a week. Yeah. Well, you have 48 students. It takes a while. And I
not to get too, personal, but do you feel that the time you spend in grading, do you think the students get as much out of that grade when they get it back from you as the thought and energy you've put into kind of crafting that grade?
I don't, because in part, I don't believe they're actually reading the feedback.
Okay. So they're not reading the feedback, right? What are they're looking at the number, right? And then they, if they get a good number, they probably just move on, right? And if they get a bad number, then they probably email you and ask you why they got a bad number. And they may look at the feedback, but I don't think they always internalize it. I think my guess is that you summarize the experience of a lot of faculty where you put a lot of time and energy into creating this assessment, that you have students that get very hyper-focused on the grades. And then at the end, the number seems to be all that carries through, even if you give them good feedback around that number, or even if you've built in ways for them to get feedback about how they're progressing. So if you have a final big exam and you've given them multiple quizzes, it's not always that the students take the opportunity to use those quizzes as feedback to how they're going to do for the big grade. So I think one thing is we invest a lot of time and energy in worrying and thinking about grades, but I'm not sure they mean what we think they mean. So that's one reason I would say it's worthwhile rethinking the whole idea. The other idea, as I talked about, is kind of what's the end goal of your grade? And if the end goal of your grade is to tell the students how good they are at the specific material you've given them, then the grade kind of works. But if your end goal is helping foster their ongoing learning, then I don't think grades kind of work at that. So what do you do instead?
So how do I know that a student is progressing? You spoke about dashboards earlier and kind of getting, it sounds like a more holistic idea of where they're progressing in other areas, but let's go into just one class that I'm teaching, and I need to know how this student and the other 40-something students are progressing.
Great. Yeah. So we have 50 students, right? You have about 50 students you're doing online. So tell me what course it is.
So it's American government. Okay. So it's a required course right now for undergraduates. Okay. So they're not necessarily intrinsically motivated to be there and to dive into the content. Some are, but a lot are not.
Yeah. And at the end, understanding how our government works is a valuable tool no matter what you do for the rest of your life. So there's clearly a lot of value that can be taken out of anyone who takes that class. And I think intuitively, if you talk to a student and said, is it important to you that you understand how the government works if you're going to advocate for change in the society? I think most students would say yes. Yeah. I don't know. Does that ring true for you?
I think so. When you hear them in the discussions, it sounds like that certainly they are inclined to wanting to be involved in government and be active in even knowing what's happening locally. But then sometimes the completion of the work doesn't necessarily reflect what it sounds like their goals are.
Yeah, exactly. So, in a case like that, I think a grade doesn't actually help tell you much about how well prepared they are to interact with our governmental system. We are educating students, and hopefully they are more, they're more engaged in society after they leave. And part of the reason we do higher education, right, is because we want them to be productive members of society. But, if you get focused on kind of that grade, what students tend to focus on is kind of the specific facts or the knowledge they need to do. So the question is, how do you look at progression? And so you can monitor progression in a lot of different ways. So that's not my area of expertise, but kind of spitballing. So looking at how engaged, asking students, how engaged are you in local government, or how much do you know about these, about these facts, or here's an issue. So you could send a poll out. Okay, how much, tell me how much you know about this specific topic. So you could create a poll and ask students, like, how much do they know about a local government issue? And then asking them to write a reflection on, write a 10 word or 20 word summary of what you think this topic means to you. So very quickly, you can get a sense of how engaged are students. And so that's monitoring their progression towards the goals you want. Now, you don't have to give them a grade to that. At the end of that, using mini assessments like that, or even, you can run you can give them a test. You can say, hey, how much do you know about this topic? You can use that as a tool. In the end, you can say to students, I've built a topic of, based on your reflection questions, based on kind of the surveys we've done, based on a test we've done, here's where, here's how engaged or how much I think you know about kind of the material we've covered. And then they leave with not a grade, but just a sense of like, this is how far I've progressed. And you can say, if this is all if you don't want to know anymore, if you feel like you've gotten enough information, great. Use this tool for your next class. If you want to know more, here's the resources. Here's where you need to go from here. And allow students to kind of pick and choose of, hey, these are areas where I really want to continue to explore, or these are areas where I don't. And we're handing that student off. So if you're handing the student off to the next professor who's going to go and, talk about the next level of that, they actually know where the student started. So then they can look and say, if you say, oh, they got an A, then they assume that the student knows the material. Well, the student might know how to get a good grade. They may not actually be engaged in the material. And so I think it gives an advantage to a really truly hand off to the next person who's teaching them. And from a medical standpoint, I look at that all the time. We have students who are doing really well in their medical knowledge in the first and second year of medical school, and they get into clinical work and they can't do anything. And that's just because they know things, but actually active learning how to take care of real patients becomes a real challenge. And they really struggle until they get a lot of support to kind of say, okay, well, this is not something you have ever done before. So you need to start practicing and learning. And to me, being, what I want when I get a student in the emergency department who's coming in, they're a fourth year medical student. When they come in, I don't really care how well they did in biochemistry. What I want is to have a sense of where are they in the learning progress? How can I plug in to helping them progress and learn from their experience working with me in the emergency department, and then make sure when they go into residency that those experiences have made them a better resident.
So assessing their progress doesn't have to be a 5-page paper. It can be small.
Yes, it can be small.
Checks.
Yeah, it could be small. Again, I think the real cool thing about that is it doesn't have to be a long thing. It doesn't actually, as a university, we're going to have to really, from the top down, if we did something, even if we started doing something like this, we're going to have to rethink of how do we, empower faculty and give them tools to kind of do shorter, more, a little bit more, maybe more in-depth assessments, but not necessarily something where you're taking 10 hours to do something that took you 2 hours before. In your class, we talked about active learning, run an election would be a really cool way, I think, to, and I don't know what all of you know, but like even in online, thinking about that, okay, like let's run an election and have some things built in where, someone's cheating, or you create ways to tip the scales and have students actually, usually when you do things like that and you create some degree of productive conflict, students get really engaged. And so you can imagine a lot of ways where those types of things, the students are going to self-assess them, probably, they'll do self-assessment more honestly, but also you can look at what they've done as individuals, as a group, and kind of say, hey, here's where you are. And, here's the next step if you want to go further.
So where do due dates fit into an active learning approach? Because if I don't give students a due date, they won't do it.
Yeah.
They will do it when it's due.
Yeah.
The majority of them.
Yes.
So if you have students engaged and you're helping guide their learning specifically to what they're interested in and what they're not understanding, then are they just wanting to just go for it and push forward to the end of the course, or do you still have to have due dates?
I think due dates are a reality of life. I think, there's a lot of things like our taxes are due at certain, having that skill of knowing when things are due and how to time allocate appropriately is an important skill that everyone needs to learn. And so due dates are really important. I think the challenge and the reason I don't like grades is if you say, this is due by this time and here's your definitive grade, students don't get the growth-minded message as much of this grade says how far you are now based on the work that you put in at this time. And there's an ample opportunity for you continue to work and grow at this thing if you want to. It tends to be, and we were talking about it during the break, it tends to be this idea of I learn all the material, I submit my paper or I take my test and I get the grade, and then that information leaves my working memory forever. And I know that I did well or I did poorly on something, but it doesn't actually influence the way I learn for the rest of my life. So I think due dates are really important. You still want to say, I want to pick a time point of this. I need to know how well you're doing at this time point. But if you make it sound too final, and so all the work and growth mindset says that when we tend to kind of give grades, or when we tend to kind of tell people, this is how smart you are, or this is how good you are at math or science. What that tends to do is the people who are really good, they tend to think that it doesn't take hard work. I'm just naturally good at this. And the people who are bad think I'm bad at this. It's not worth trying. And so, yes, do due dates, but keep that growth mindset message of this is where you are now. It's important to have an assessment of where you are. Just like when you're driving a car, it's important to know where you are on the map. That's where you are now. It doesn't mean you can't go somewhere else. It just means you're going to have to work hard at getting to the next stage of where you want to go.
So if we don't have grades and we're going from undergrad to graduate school and we don't have a grade to show for it, say we start here at AU and we didn't have a grade, and now I've graduated and I want to go to another school over in another state and get into grad school, and they say, where are your grades?
Yeah. And you say, nope, don't have any of those. Yeah.
So what do we do?
I mean, to me, if we as a university embrace this, or any university embrace this, we would have to create, and we need to create, a robust portfolio to actually demonstrate how is the student progressing, and have true assessments of this is our mission of as a school is. Our mission is to create active learners. Our mission is to create growth-minded learners. This is how we do it. And here are all the things here's the narrative summary of what we can tell you about a student in terms of where they are, where they can be, how much work they put into things. And you have an opportunity then to tailor those. So you would need to build in some people who understand our system and then can write very good letters of recommendation and say, this is where the student is. This is how well we think they will do. You're going to have to be a little more honest too. I mean, to be in all reality, you're going to have to be more honest with the students and the schools and say, hey, we think this student is ready for this level of graduate work. Or you know what? This student isn't ready for this level of graduate work. Here are the things that they probably need help with to get to that or to get that level. And I think, to be honest, seeing lots of medical students, I would love to see something like that. So I get undergraduate medical students. I would love to say, rather than knowing what their grades were, in fact, I never know what students' grades are coming in, but rather than knowing that is a good portfolio of like, this is what they've done, and this is how hard they've worked at things, or here's their areas of weakness. This is the stuff we need to kind of shore up in medical school to actually help them learn and grow. I think most graduate schools would really embrace that as, wow, this is a school that's really committed to students learning rather than just me giving a bunch of papers. It's going to take education, right? And it's going to take a rethinking of what we want our students to get out of their undergraduate or even graduate education. I think we can do it, though.
Okay. It's lots of great things to think about. I do want to ask our continuing the conversation question, which is for someone considering adding active learning methods, where do you recommend they get started?
Yeah. So, and we'll go back to so I think one of the great opportunities is if you are in a situation where, wow, okay, I buy into this idea that I want to get students more engaged in something, is pick an area that you think is most interesting about your field, whatever it is you do, and realize that for most of us, hopefully almost all of us, right, getting grades as educators is, I don't get a grade anymore. I get reviews from my students, but in the day-to-day things I'm passionate about, I don't tend to get grades. And so pick something that you find is most exciting to you in your field, and however you learn about that or whatever you do in that area, turn it into an activity that students can do. So again, if you're doing government, turn that into, hey, these are some things that I find really interesting. Dissecting you could even do just dissecting a news article, having a pro-con debate. That's active learning. Maybe that's something that you get very excited about. Or for me, one of the things I do with our medical students is I run an Ebola outbreak simulation. So I do a lot of global health work. I've gotten to talk to a lot of physicians. I've gotten to see physicians working in outbreak scenarios. And to me, that was a very stressful environment to hear about the physicians that had troubles with resource limitation, had troubles with all the political infighting that occurs, and realizing there's a lot of conflicts of interest and there's a lot of specialty interest in that. And so I said, wow, I could give students a lecture on global health and talk about the Red Cross, the Gates organization, what the WHO does, what the CDC does. I could talk about all that stuff, and I could talk about how to respond to an Ebola outbreak, and I could talk about Ebola orphans, and I could talk about all those things about, hand hygiene or even burial practice and all the challenges of that. Or we could just run a simulation. They can work some of that out on their own. I can give them some information where they can go and do their own research, and then they can interact. And we can come back and have a discussion. And so I would say, to me, that's worked really well as the students bring that information. I'm learning from them. Again, it's kind of this joint productive activity where I send them out, they have an experience about something that I know enough about that we can kind of interact. And it's something that I find very interesting to think about. And then we come back and then have a debrief conversation. So pick an area that you love doing in your, kind of in whatever line of work you're in, and then allow the students to experience that, even if it's in, a very short form of pro-con debate or something like that.
Are there any particular books, researchers, authors that have influenced you that you would recommend for people to get started with?
Yeah. Okay. Yeah. So, I talked about, Carol Dweck and, her work in Growth Mindset, I think, is an amazing book if you want to just think about what we've done and kind of how we have fostered in education a lot of fixed mindset folks that are very focused on, how good they are now. So I think reading about growth mindset is a really interesting thing to think about. I will not remember because I didn't prep for this part, but I won't remember the name of the author. But there's a book that's very interesting. It's a little controversial called Excellent Sheep. And it's a professor, I believe he's at Yale, who writes very much about how our educational system has essentially fostered people who are very good at doing what they're told to get the grades they need to get to the next stage, but are actually very poor at thinking for themselves. And so that's another book if you want to read about kind of how our education system has probably failed our students. He's pretty negative on it. But I think it's a good, if you're kind of interested in that, that's another interesting thing. I think again, for those who are like much deeper into the world of educational theory, a lot of the work that Vygotsky did. So Vygotsky really pioneered the idea of zone of proximal development and how students progress through those zones. There's a book called Rousing Minds to Life, which again, I'll forget the authors of that, but they're writing about kind of I would say elementary school kids, but a lot of the things they talk about in terms of how we assist students and, not only what we assist, what we're doing, but why we're doing what we're doing. They write a lot about that. So I think that's a really more in-depth book. So those are some kind of really some books that I've enjoyed in terms of shaping some of my specific beliefs around educational theory.
Well, thank you for sharing that with us, and thank you for being here.
Yeah,
appreciate it.
Excellent. Happy to be here.
I also want to thank our listeners. Please take a moment to rate, review, subscribe, and share. Speaking of higher ed, we release new episodes the third Wednesday of each month in spring and fall semesters. You can find the resources we discussed today on our show page at augusta.edu/innovation. Find us on Facebook at facebook.com/AUGCII. You can also email us at cii@augusta.edu. Speaking of Higher Ed is produced by the Center for Instructional Innovation at Augusta University.